Thank you, Dr. Jayant. Yeah, I'm fortunate I'm also bearing your name. And SB is a friend for last 30 years and a very cordial environment. And both the lectures were so informative in pediatric diabetic session. I'm very happy. I'll be very brief and direct to you all on this topic. Adolescent diabetes. When we talk of early treatment of type 2 diabetes in adolescents, unfortunately, we are gradually traveling towards diabetes in the lesser younger people. And finally, the adolescents who should play, who should jump, who should sing around and celebrate their functions are unfortunately with the tablets, with monitoring, with the treatment, and creates a very panic situation in family, in society, and in a fraternity as a whole. So many people become very concerned. You see, when parents suffer or grandparents suffer, they don't seek treatment. When a child suffers in the family, immediately they rush to the hospital. नहीं कुछ तो करो डॉक्टर साहब मेरा बेटा का डायबिटीज निकल गया my son or daughter is diabetic that makes things panic. So very quickly I'll take you through few issues. These are not very loaded slides. I've done very light slides just to make you aware, and the summary I have put in the first line itself: empower early, prevent complications. You have to empower them early, prevent complications, winning the battle against type 2 diabetes in adolescents. So, the lifestyle is the mainstay, and the treatment hardly has any drug. Below 18, we don't have many drugs approved. I'll just touch upon three drugs: the metformin, the GLP-1, and SGLT2 inhibitor. But the rest is lifestyle, and lifestyle. So I have already told about type 2 diabetes in adolescent, the panic situation when a young child or a young man gets the infection or the syndrome. The rising prevalence in adolescents. Unfortunately, we have more and more adolescents. They are being diagnosed with type 2 diabetes. In the young scenario, if you'll see, it's mostly type 1. Few come as LADA, few come as MODI, few come as pancreatic diabetes, few as different syndromes. But now with poor lifestyle, increasing obesity, faulty diet, lack of exercise, lot of stress, social media, sleep deprivation, the diabetes is touching younger and the younger people. So the rising prevalence in the adolescent, and you can see India coming in more than 20 million group in the world map of young diabetes, and thus make us concerned. We are among few countries who have a rising population of young adolescent type 2 diabetes. The early treatment has multiple benefits. The most important is prevention of complications. When somebody is detected at 15 years or 18 years or 12 years, the most important challenge remains to make him complication free for longer time. So if you empower early, control early, you get a metabolic memory and legacy effect. We know the body recognizes some early intervention and continues it further, reducing a risk of psychological burden and psychosocial burden. It's a very important issue. The boy or girl gets stressed. Now I'm having diabetes at the age of 15, at the age of 20, and what is my future? How can I live a life of 50, 60 years? The big question comes to them. Uh, the healthcare cost can come down if you empower them early. You can improve the growth and development. You see, many have not completed their growth cycle, and then they need to grow mentally, physically, and then psychologically, and that is important and with a better quality of life. So early treatment matters for prevention of complications, for preventing the cardiovascular, renal, neurological issues, and also this what we talked about, the psychosocial, about the growth, about the education, and In the type 2, the important matter is the insulin resistance. We are not discussing other young diabetic, we are discussing type 2. To type 2, the insulin resistance is very prominent, which is usually associated with childhood obesity, and you have to detect the obesity as well, and you have to treat diabetes and obesity together. So here comes the risk factors. I told the first comes obesity for this group, then sedentary lifestyle, the family history, the genetic exposure, the ethnic background, and the diet choices. And if you see the young mash, every parent must have noted this. People are not willing to take food which are our traditional Indian. Every parent is worried. I talk to my friends. This Swiggy, Zomato people have brought a big change in their life. In the middle of the night, they're asking for the burgers, they're asking for the pizza, and whatever you do, you cannot control your children. They are the new generation, and they are high risk behavior. They take the fast food, they take the soft drinks, they take the diet which they should not have taken. They don't go for a walk, social media till late night, getting up at 10, 11, and completely the lifestyle has become hazardous, exposing them for young type 2 diabetes. So in treatment, first thing we have to think of changing their lifestyle, and that will help us. Diagnosis, you'll do so many tests, but important is the classical features like acanthosis nigricans, which shows the insulin resistance, unexplained weight loss, increasing thirst, and the blurred vision because of the edema, slow healing of wound, fatigue, and the frequent urination, what's there in the adult diabetes. So diet is something very important, and they may not agree to you or agree to family for the traditional diet of rice, dal, chapati, and lot of vegetables. Usually they don't agree. So what you need to enforce upon them is the fiber intake. In their diet, whatever fiber you can add, the low refined carbohydrates, high fibers, and to prevent the calorie as much as possible, because Indian diet 60 to 70% is carbohydrate, carbohydrate, and carbohydrate. The glycemic index concept, if you can give, and early morning, if you can take them for a walk, that's the best possible intervention for this adolescent, and you have to talk to the parents regarding that. The 30 to 60-minute policy of increasing the insulin sensitivity, recommending the strength training, aerobic activities like walking and swimming, they may not agree. The traditional, the old man or a woman can walk on the road in the morning, but if you tell a young adolescent, they'll not agree. What you have to do is to take them to the games. The gym they are very fond of. If you ask your children, they like gym because there is something energetic, body component analysis, and some cardio, some but unfortunately they are not doing aerobic exercises. But you have to talk to them regarding lifestyle at least for 30 minutes a day. The weight management is emphasized upon. They like losing weight, but unfortunately their lifestyle, the late night sleep, the lot of carbohydrates, the at times irregular food timing doesn't help them. But even 5 to 10% weight loss helps them out. The behavioral changes in the long term success is very important. Where comes 7 hours sleep, hardly I have seen any youngsters who is sleeping for 6 7 hours. They never mind even they don't sleep at all throughout the night. Rightly the song has come, the party whole night, and then they never think of their taking a break. And night is very resourceful for them, because day, the college, the class, the teacher, the parents, and everybody is watchful. Night nobody is there, they all are sleeping, and they're having their night life. And the important is the screen time, the television, the mobile, the the computer, the activities, the stress, lot of confusions, and then the youth which is not expected to do, they are doing. That's what the diabetes has been attracted to the younger age group. In medications, the only drug approved till now was metformin. It's a sensitizer. It helps us in borderline weight reduction, also decreases the appetite, causes dyspepsia, and that is what you need to do. But before starting metformin, you have to be sure that all ways of lifestyle is exhausted: the diet, the exercise, the stress management, the sleep, the screen time. Everything has been touched upon when before we come to the drug. And when you fail in every front, because once you start the drug, the children will go to their hazardous lifestyle, giving the reason we are already on treatment for that. Let us do whatever we like. So that is something very dangerous. GLP-1 has come promising and then gradually being dragged to the younger age, because it's a very good drug with cardiorenal benefit, and also they help in weight loss. GLP-1 has come to this field, especially Lira and Sima, with the promise that they help losing weight, they help controlling the insulin resistance and the hyperglycemia as well. The SGL2 inhibitor is again emerging therapy, and many, though there are little controversies, many authors are of the opinion this should be extrapolated in the adolescent group, with the benefit of the heart and the renal complications, and also weight loss along with the control of the blood glucose. And when you fail with metformin, when you fail with the sensitizers, when you fail with the GLP and the SGLT, and the weight is going up, sugar is going up, no lifestyle change, you have to adhere to the insulin in this age group. In fact, till now in the adolescent, the approved drugs were metformin and insulin. Now we have GLP-1 and SGLT2 inhibitor, which is being extrapolated here. The CGM is very useful in them, because one thing is good in the youngsters, in the adolescent, they're very savvy of technology. They understand technology very well. So anything you explain them technology wise, they'll take up. If you ask them for CGM, they'll love to do a real time blood glucose data and see how things are fluctuating and how they can affect their heart and kidney. So the psychological impact, I told, is higher in the adolescents. That has to be taken care of. The complications of untreated diabetes are known to all, that are to be targeted and to be explained to the person, and you have to screen them. The preventing diabetes at risk of adolescent is very important. Before they become prank diabetes, the detection of pre-diabetes, detection of the obesity, detection of the high risk factor saves them from going to frank diabetes. The family's role is very important, because they have the hormone to divert them, to damage them, and to go away from their regulated lifestyles. The adolescent medication adherence is again challenged. When they want to do party and enjoy life, taking a drug timely, hardly they follow. The telemedicine somewhat they prefer as a part of the technology, but we don't bring much change because they don't adhere to the treatment. Bariatric surgery for severe cases can be taken, and it has been shown as useful in adolescent group. But school-based diabetes prevention program is very useful, where you can talk to the people who are at risk and ask them to do, and the community intervention and the awareness helps them getting educated. Latest advances in the diabetes treatment, like artificial pancreas, like gene therapy, beta cell regeneration, and personalized medicines, can be extrapolated to the adolescent. Impact of social media in diabetes awareness is great and has a great impact on the adolescents. And the teens diabetes reversal through the lifestyle and the GLP, and also the digital health apps help us acquiring good control, as well as the bariatric surgery in adolescent. I told the future health risks are many. The genetic research is going on, and future of diabetes treatment like stem cell therapy and bioengineering pancreas as well smart insulin delivery system should be taken. So the early treatment prevents complications. Lifestyle change remain the most effective. New medications and technology improve management, and family, school, and community support are vital. So, addressing type 2 diabetes in adolescents requires a multifaceted approach combining lifestyle changes, medication, technology, and support system, and they are a completely different population whom you have to target with a very emotional and compassionate mind, where they'll listen to you, change their lifestyle, and little lifestyle change will not require drugs for their intervention. Thank you for the time. Thank you for the
Thank you.
opportunity.